Hello guys, welcome to our channel Medicogyaan. I hope everyone is liking our videos. Please subscribe our channel if not already done and press the bell icon button to receive further notification. Stay tuned and stay updated. Today the topic of discussion is HCM. It is one of the most important topic in the cardiovascular system. HCM, which means hypertrophic obstructive cardiomyopathy. Hypertrophic obstructive cardiomyopathy. This is HCM. HCM is hypertrophic obstructive cardiomyopathy. Basically, HCM is an autosomal dominant disorder. Autosomal dominant disorder. Autosomal dominant means there is a structural defect. And where is the structural defect? It is in the beta myosin gene, which is present in the chromosome number 14. So in chromosome number 14, there is a beta myosin gene which is defective, leading to the hypertrophic obstructive cardiomyopathy. In a normal individual, this is right ventricle and this is left ventricle. But what happens in cases of HCM? There is asymmetrical hypertrophy of the septum. There is asymmetrical hypertrophy of the septum. And on the cut section of it, it looks like a banana appearance. This is right ventricle, this is left ventricle. It is in the normal individual. So in the normal individual, the heart is normal. But in the case of HCM, this is right ventricle, this is left ventricle. There is asymmetrical thickening of the interventricular septum. The septum which is present in between the ventricle is hypertrophied asymmetrically. So there is asymmetrical septal hypertrophy. And when we take a cut section of the left ventricle, it appears like a banana. So the cut section looks like a banana. Because of the asymmetrical hypertrophy of the septum, there is decrease in the cavity of the left ventricle. What happens here is there is a decrease in the cavity of the left ventricle because of the asymmetrical hypertrophy of the septum. Because of hypertrophy, there is diastolic dysfunction. The ventricle is not able to relax properly and receive the blood. The perfusion of the endocardium takes place in the diastole. As there is diastolic dysfunction, there is subendocardial ischemia. There is ischemia of the subendocardial region because of the diastolic dysfunction. So guys, as there is diastolic dysfunction, it means the ventricle is not properly relaxed. So there will be subendocardial ischemia. The congenital heart disease are mostly detected by the antenatal ultrasound around 20 to 24 weeks. And in India, as you know, the medical legal age for the abortion is 20 weeks. So we can say on cut section, the left ventricle cavity appears banana shape, which occurs in HCM. But for MCQ purpose, if somebody asks banana sign, then banana sign is different. The banana sign is a sign of Arnold-Chiari malformation. So there is a banana shape and there is a banana sign. The banana sign takes place in Arnold-Chiari malformation. So now the clinical features. Suppose you are sitting in an OPD. An individual comes to an OPD saying that he is around 10 to 20 years of age and mostly it is a male individual. He says, sir, for 10 to 20 years of individual come to your OPD and he will say that, sir, I'm having shortness of breath, I'm dyspneic. So he himself is saying, sir, I'm dyspneic, and because of diastolic dysfunction, as the ventricle are not able to relax properly, there is a pulling of the blood in the left atrium, and there is a pulling of the blood in the lungs, leading to pulmonary edema, and this pulmonary edema leads to dyspnea. Second, as the ventricles are not relaxed properly and the ventricles are not receiving the blood properly, so the blood will not be ejected properly, and the patient will complain of effort intolerance due to decrease in the cardiac output. And lastly, the patient will say, sir, I do also complain of chest pain. I do sometimes have chest pain. So whenever I try to run, there is a pain in my chest. He mostly says that no one includes in me a team, and whenever they include, I'm mostly a 12th man. So in a football match, he can be seen as a 12th person. And whenever I'm instructed to play, I run fast, and because I run fast, there is increase in heart rate. Because of increase in the heart rate, there is decrease in the diastolic time, leading to subendocardial ischemia, leading to chest pain. And I'm afraid, I've studied in the books, I've studied in the Google, that in such patients, there are chances of sudden death also. So he comes to an OPD complaining of dyspnea, effort intolerance, and chest pain. In HCM, as you know, there is obstruction. Because of obstruction, there will be delayed closure of the aortic wall. The aortic wall will be closed, delayed. This is A2 wall, this is P2 wall. Basically, this is a second heart sound. Because of the delayed closure of the aortic wall, there will be delayed closure of the S2 sound also. So narrowing of the second heart sound. Narrow closure of the second heart sound, known by the name of dub. So is there any investigation which I can be told to do? I will tell him, yes, there is investigation on by the name of TEE. And there is also something which is known as systolic anterior movement of the mitral valve, which occurs because of subvalvular aortic stenosis. So I will tell him to get an TEE done, as on auscultation there will be delayed closure of the aortic valve and there will be systolic anterior movement of the mitral valve. Now comes the treatment part. So what is the treatment of HCM? Basically in HCM there is obstruction leading to hypertrophy of the interventricular septum, leading to subendocardial ischemia. So I will prescribe the patient beta blockers such as propranolol, or I can prescribe verapamil. This beta blocker will decreases the heart rate, decreases the risk of subendocardial ischemias, decreases the risk of chest pain. But when I tell the patient that I am prescribing him beta blocker, as the patient was educated, he says, sir, I am having a family history of diabetes and cholesterol. My parents, my grandparents, all of them have diabetic and hypercholesterolemia. So I will tell him, as it was a family history of diabetes and increase in the cholesterol level, so I will tell him that beta blocker is not the drug of choice for you. You should be taking verapamil. So I will prescribe that patient verapamil, not beta blockers such as propranolol, because there is a family history of diabetes and cholesterol. Now, because of pulmonary edema. As is pulmonary edema, normally what we do in pulmonary edema, we prescribe the drug, we prescribe them diuretic, Lasix, to remove the fluid. Normally what we do, in cases of pulmonary edema, we will prescribe Lasix to remove the preload, to decrease, but Lasix will decreases the preload, decreases the right ventricular inflow, decreases the left ventricular inflow, which will further decrease the systolic blood pressure, and there is increased risk of death. So we can say diuretics are contraindicated. Hence, diuretics are contraindicated. Along with the diuretics, digoxin, nitroglycerin, ACE inhibitors, nifedipine, and furosemide, as already discussed. These 5 drugs are contraindicated in HCM. These are contraindicated in HCM. So, I will be giving him beta blockers such as propranolol or verapamil, and I will tell him to get an Holter monitoring done. In Holter monitoring, if there is sustained ventricular premature beat lasting more than 30 seconds, so there is increase in the risk of HCM and increase in the risk of sudden death. So I will get him an Holter monitoring done. After this, the treatment part consists of ICD. What is ICD? ICD is implantable cardioverter defibrillator. Implantable cardioverter defibrillator. It is a small device, 2 by 2 millimeter device, which read and analyze the ECG and gives the DC shock to prevent the sudden death of an individual. So basically, the ICD will detect the ECG and will give the shock to prevent the sudden death. So ICD should be done, can be implanted. This is an ICD. It is implanted in the left part of the chest, beneath the skin, below the skin. It is implanted in the left part of the chest, beneath the skin. So this is an ICD. And it will send impulse to the heart. So an ICD will send impulse to the heart. First, it receives the impulse from the heart, then it gives shock to the heart. It gives DC shock rather. But in case if there is a dislocation of the wiring and the wire are opaque, which can be seen on the chest X-ray, so ICD will think that the heart is not beating and will give DC shock continuously. ICD will think that the heart is not working properly as the impulse from the heart is not reaching the ICD, and it will give the DC shock. So the patient will complain of receiving continuous electric shock then. So I should be doing chest X-ray to see whether the radio opaque wires are in continuity or not. So the chest X-ray should be done to see whether ICD is working properly or not. Because if the ICD is not working properly, then there are chances of increasing the risk of electric shock to the patient. So I have studied it is an autosomal dominant disorder which occurs due to beta myosin gene of the chromosome number 14. What happens? There is asymmetrical hypertrophy of the right ventricle septum, as we have already studied. So what I will do, I will inject alcohol into the interventricular septum, which is hypertrophied. I will inject alcohol into the septum, and this is known as septal ablation. So everyone, please have a point. So everyone, please look into this. that there is in case in the that in cases of HCM, I will be doing septal ablation. After doing septal ablation, the cavity of the left ventricle increase in the size. So there is increase in the ventricular cavity of the left side. Now comes various type of cardiomyopathy. We can be having dilated cardiomyopathy, restrictive cardiomyopathy, and arrhythmogenic right ventricular dysplasia. The treatment of choice of all the three is cardiac transplantation. One of the most common reason of DCM is alcohol intake. Restrictive cardiomyopathy occurs due to amyloidosis. It occurs due to amyloidosis. And ARVD, we shall be discussing this later on. But one of the most common type of cardiomyopathy is still the HCM, which is treated by alcohol-based septal ablation. So if we revise HCM in last 15 to 20 seconds, it is an hypertrophic obstructive cardiomyopathy, which is an autosomal dominant disorder, occurs due to beta myosin gene on chromosome 14. There is a banana-shaped cavity, banana sinus, Arnold-Kelly malformation. There is a delayed closure of the AT wall. Beta blockers are given, verapamil is given, diuretics, digoxin, ACE inhibitors, all these are avoided. So thank you everyone for watching this video. Please subscribe our channel if not done already, and press the like button. So thank you for watching this video, and check out the latest Medicogyaan at www.medicogyaan.com, and follow us on Instagram, Twitter and Facebook account at medico-gyaan.com. Thank you everyone. Stay tuned and stay updated.